Today, we're going to talk about a topic that we're hearing a lot about in the media, and that's hepatitis. There's three types of hepatitis: hepatitis A, B, and C. And Dr. Frank is going to address all three of these today and give us a little bit of an insight about why we're hearing about it more often and can CBD help. So, Dr. Frank, what is hepatitis?
Yeah, of course, Stacey. So that becomes a really complex question after we dig beyond the surface, right? So for today's purposes in our discussion, I'll agree with you. We have hepatitis A, hepatitis B, hepatitis C, and then another big one out there is autoimmune hepatitis. Now, we could jump into it, and I'm sure we'll have people say, well, there is technically a hepatitis D and a hepatitis E. We're just going to stick with the big ones that we're hearing a lot about for today's discussion. So it's important to understand that with hepatitis is the virus. So a virus attacks our own body cells. So when we obtain a viral infection, the virus invades your own cell's hardware and machinery. This virus will then replicate over and over and over again, producing cells that are no longer healthy because they've been affected by this virus. In the case of hepatitis, it infects the cells of the liver. So whether we're talking about hepatitis A, B, C, or autoimmune hepatitis, we are talking about liver dysfunction. It's important to realize that our liver is responsible for glucose metabolism, so blood sugar. This is how our body has energy to do stuff throughout the day. It's important for blood clotting factors. Our liver is one of the most important organs when it comes to detoxifying our blood. So the buildup of toxins can occur if our liver cannot properly detoxify. It also plays a strong role in cholesterol health. So as you could imagine, people who suffer from any one of those forms of hepatitis are at risk to not only have liver issues, but other health complications as well. That's why you usually see diabetes or cardiovascular disease accompanied by a hepatitis infection. With that being said, I'll break down the different types of hepatitis. So hepatitis A, we hear about this one a lot. This virus is usually carried in the stool. So people who don't do a good job washing their hands, perhaps through sexual intercourse, it can be contracted. Any contact with stool or fecal matter leads to the transmission of hepatitis A. Hepatitis B has more to do with blood or bodily fluids. So again, it can be sexually transmitted. Anything that puts you in contact with someone else's bodily fluids, of course, can put you at risk of hepatitis B. Now, hepatitis C is, I would say, one of the more common ones that we hear about, one of the more chronic ones that people suffer from. Hepatitis C is contracted through the blood, and there's a lot of things that can put people at risk for hepatitis C. So if we have someone who uses drugs and uses needles, that could be an issue. It could be through a sexually transmitted disease. That could be an issue. It can be transmitted to a child during birth if the mother has hepatitis C. This is commonly seen in medical settings. If sterileness is not a top priority, we can see the spread of hepatitis C. So there's a lot of different causes for hepatitis and a lot of different ways that it can be transmitted. But at the end of the day, hepatitis is a viral infection that hijacks our own cells' machinery and replicates. And when it replicates, it causes damage to the liver. Now, people, of course, will ask, well, how do I know if I have hepatitis? Of course, this is why you go see your primary care physician. When your doctor runs blood work, they may look at elevated liver enzymes, AST and ALT. This may be a clue that there's hepatitis issues. They may run antibody testing to test for specific different types of hepatitis, A, B, C, autoimmune hepatitis. Now, symptoms will also be important to keep in mind as well, too. I think one of the hallmark symptoms that we think of with liver disease is jaundice. That's a yellow discoloration of the skin, especially around the eyes. We may also think of fatigue, depression, anxiety, sleep disorders. Joint pain is very common in people who suffer from hepatitis. Itchiness, skin rashes sometimes can be a telltale sign of hepatitis. So when we take a combination of the symptoms, we combine that with the blood work, and we combine that with the risk factors. Was this person recently in a non-sterile restaurant? Was this individual exposed to IV drug use? That's how we really start to paint a picture of who's going to develop hepatitis and what is the likelihood of it affecting that person.
Is hepatitis, I know we've talked about 3 different types, primary types of hepatitis. Is it treatable, and are they all treated the same?
So it does vary from the type of hepatitis that you have depending on the treatment. Sometimes you can use, for example, if it's an autoimmune disease related hepatitis, they may give that individual immunosuppressants. If it's one that has more to do with a viral infection, they may provide during that acute phase antivirals or interferon medications that can disrupt how a virus replicates. So it really depends. In most cases during the acute phase, a lot of people don't even realize they have this viral infection. So in those cases, it's not treated. In many cases, it can actually be self-resolving. But I would tell anyone who is suspicious of an infection, who feels that they may have been exposed to hepatitis, go see your physician, because depending on what stage it's in, whether it's acute or chronic, depending on the variation of hepatitis, yes, sometimes there's treatments. And in other cases, the best option may be, hey, let's just wait and see. Right now, the liver isn't being affected. We're not starting to see the buildup of scar tissue, one of the hallmark signs of hepatitis, cirrhosis of the liver, a scar tissue buildup on the liver. If we're not seeing those things, no. Treatment in the beginning may not be indicated, but that will be between the individual and their primary care physician.
Now, we've talked about CBD helping people with inflammation. Whenever there's disease, we know there's inflammation, right? And we're speaking specifically about perhaps inflammation in the liver. So it's logical for us to think that CBD can help. So is CBD, is maybe early research showing that CBD can help with all 3 types of hepatitis?
Sure. So one of the main things when you look up the current research on CBD oil and its effect on hepatitis, the 2 main areas that it's really focused on is hepatitis C and autoimmune hepatitis. Hepatitis B and hepatitis A, there's not much to be said right now as far as the use of CBD oil goes. But I can say what they did see in one of the studies, and this was a in vitro study. So what that means was this study was done in a test tube, okay? They took the hepatitis virus, they put it in a test tube, and then they added CBD oil to this virus, and they wanted to see what happens, okay? So these studies were not carried out in humans. They were not carried out in animal models at this time. Well, what the study found was with the addition, and it was dose dependent on the amount of CBD oil added, of CBD, with the adding that to a hepatitis virus, an active hepatitis virus, it stopped the replication of that virus by 84.6%, I believe the statistic was. So of course, initially, that's a very, very promising result. Now, we can't say for certain how that's going to translate over in a human model, or even right now in an animal model, but for very early research, that would appear to be very promising. Now, we can say this, yes, CBD is an anti-inflammatory. At the end of the day, hepatitis results in an inflammation of the liver, especially when we're talking about an autoimmune-driven hepatitis. We do know that CB2 receptors are found all over our immune system. CBD oil impacts CB2 receptors and has the potential to turn off some of the strong inflammatory cells that float around and cause more inflammation. So your macrophages, your T cells. CBD seems to quiet some of these inflammatory markers down, and that is very, very promising for people who may be suffering from autoimmune disease-related hepatitis. And of course, we mentioned earlier, for people who suffer from hepatitis C, CBD oil may also be very promising for them as well. Now, with that being said, whether you have hepatitis A, B, C, or autoimmune-related hepatitis, what's important to realize is you may at one point experience symptoms. And we do know that if you have symptoms of joint pain, CBD can help with that. Nausea and vomiting is a very common side effect of hepatitis or the medications used to treat it. CBD stimulates serotonin, which can help with nausea and vomiting. CBD has been shown to help with mood, depression, and anxiety. Many people who suffer from hepatitis due to the stigma may have some depression or some anxiety affiliated with it. CBD has been shown to help with those symptoms. and fatigue. Fatigue is a really big hallmark symptom of hepatitis infections due to the interrupted sleep. These people have trouble accomplishing deep sleep. We know CBD oil seems to help regulate the sleep-wake cycle, promoting more deep sleep, in turn helping out with the fatigue that an individual may be experiencing day to day. So yes, we're seeing positive benefits when it comes to hepatitis C and perhaps stopping virus replication. And again, that's in a test tube. And we are seeing positive effects when it comes to CBD modifying the immune system, because in autoimmune hepatitis, it's your body's own immune system attacking the liver. So if we can quiet that down, we're probably going to be headed in a better direction. Now, I will throw this out there as a disclaimer because I find this fascinating. When they study the use of marijuana or THC, which, mind you, directly binds to CB1 and CB2 receptors, the results are kind of mixed. There's some arguments that it may actually worsen liver fibrosis and liver scarring when we're talking about inhalation of marijuana products with THC, and it may actually add to disease progression. It's important to realize that CBD oil, though, is different from THC or marijuana because CBD does not necessarily directly bind to CB1 and CB2 receptors. It decreases that enzyme in the body. It helps promote our body's own endocannabinoid levels and their ability to bind to our own body's receptors. So again, we always say CBD oil helps promote a state of homeostasis, a state of balance. And I think that's very important to keep in mind as we see future studies on cannabinoids and as we see future studies on marijuana and its potential role in hepatitis. CBD is different from THC.
Well, that's really fascinating because a lot of times you don't see that, right? It's really interesting. I think that we continue to find yet another disease, another condition, whether it's the actual condition or the disease itself or the symptoms that either the treatment or the disease cause, that CBD once again is showing promise. So although it's very early, I think that it's very promising, all the research that you've just explained.
It really is a fascinating thing. And I'll say this too, we're doing a good job when it comes to medicine. They do have vaccinations for hepatitis A, hepatitis B, irrelevant of people's views out there on that. Those vaccines do exist. We do not currently have one for hepatitis C at the time. So I do think this is a really promising outlook for those suffering from hepatitis C, whether it's helping with symptoms or perhaps in the future, it may be able to modify disease progression. And something else too, for those out there suffering, again, don't ever discredit natural, right? We're talking about CBD, a more of a natural alternative supplement to help manage this. Don't forget about other things too. Yoga and meditation to help relax the body, right? If we have less stress, we're going to be healthier. If we sleep better, we're going to be healthier. Perhaps you want to get your zinc levels tested. Hepatitis has been shown to affect the body's levels of zinc and vitamin D, which vitamin D is crucial for a healthy functioning immune system. So I always tell people, don't discredit other natural alternatives to incorporate into using CBD. I think that what complements yoga or relaxing better than CBD? If you can take a supplement that's going to help calm the body down and now perhaps prep your mind for a session of yoga or a session of meditation, that's a fantastic thing. And these are things that are not often discussed in a traditional medical setting. So,
well, I know the next question is quite loaded. It's talking about how much should I take, right? Well, we've talked about a couple things. We really, I think, to summarize, have talked about how hepatitis A and B are not really, there's no research to really show that CBD is helping from a treatment standpoint, but maybe the symptoms. And then we've identified hepatitis C, where the research is showing great promise and potentially a treatment or one of the treatments that it can be used for later on. Again, this is all very preliminary. And then we've talked about conditions. So what type of guide course, people can go to our website and read more about serving sizes, macro, micro, and standard servings. But what would you like to perhaps say if somebody is dealing with a hepatitis C, for example?
So in my world, I think the most common reason where we may wind up stumbling across a hepatitis C is a person presents to my offices and they have joint pain, right? And perhaps I can't figure out what the cause is. We run some blood work, we refer them out for blood work, and we come back with a hepatitis C infection. Well, I would do my best to use CBD oil to probably start to attack the symptoms. It's going to be very hard to monitor the disease progression, right? Unless this person is constantly getting biopsies of their liver or scans of their liver, and we're really seeing the amount of scar tissue developing on the liver, and we're able to follow that scar tissue development, it's going to be challenging. So I would monitor the joint pain, the sleep, the anxiety, the mood, and that would be for me a good indication of if CBD is working. So for us, we usually start slow with people, anywhere between 5 and 10 milligrams as a starting dosage. And then every 4 days, I would increase that until I started to see positive results. So maybe we start at 5 to 10 milligrams and somewhere between 40 and 80 milligrams a day. The individual says they're feeling much better. At that point, I would, fingers crossed, say, okay, when you go for your follow-up with the hepatitis physician that's treating you for this, I hope your liver enzymes look better. Maybe they do have a scan and they say, hey, the liver looks healthier than it did last time. That's really how we would go about monitoring it. I don't have a specific number. My assumption would be in an autoimmune hepatitis, it's going to be a much higher dosage because the body's attacking itself on top of a potential viral infection. So for those individuals, perhaps you're closer 100 milligrams plus a day. But for A, B, C, especially C, because that's really the only one we can comment on, I would just start low, increase every 4 days, about 5 milligrams a day until we saw symptoms resolving. Because at that point, that would tell me that their endocannabinoid system is responding. And that's really the only way to do it. There's no guide right now, unfortunately, on this one to say, oh, yeah, for hepatitis, we use this amount and this seems to do that. Yeah, doesn't exist yet.
Well, thank you so much, Dr. Frank. And one thing we know for sure is CBD is showing great promise in the medical community, and it's something we will definitely keep our eye on, and we're seeing great results. I know you are in your office. Physicians across the country are finding the same thing, and we love that at CBD BioCare, we can help facilitate a good quality potent product. So thank you for your time today, and I hope whomever is watching that you find this as valuable information.